Let us now go to visual diagnosis of the hands. The topic is pale hands, red dorsum of hands, and red palms. Visual diagnosis of the hands includes the observation of color, shape, and moistness of the hands and fingers, as well as the observation of the fingernails. The normal color of the hands in white Europeans should be pinkish red, indicating that the hands are being supplied with sufficient blood and yang qi. Account should be taken of the coloration of the skin in other ethnic groups. If there is heat, the hands can be more red in color. If the heat is excess in nature, this will be seen on both sides of the hand. If the heat is deficient, it will only be the palm that is red. Pale hands are a sign of yang deficiency and blood deficiency. Pale hands are usually due to either yang deficiency or blood deficiency. Heart yang or lung yang deficiency in particular may cause the hands to be pale. As for blood deficiency, pale hands are usually caused by heart blood or liver blood deficiency. As a clinical note, we use the points pericardium 6, heart 5, ren 4, stomach 36, spleen 6, and liver 8. For heart yang deficiency, there will be pale hands, cold hands, palpitations, shortness of breath on exertion, tiredness, spontaneous sweating, a slight feeling of discomfort or stuffiness in the heart region, feeling cold, bright pale face, slightly dark lips, and a pale tongue with a deep, weak pulse. For lung yang deficiency, we will see pale hands, cold hands, slight shortness of breath, slight cough with profuse, watery sputum, weak voice, spontaneous daytime sweating, dislike of speaking, bright white complexion, propensity to catching colds, tiredness, dislike of cold, a feeling of cold of the upper back, absence of thirst, pale and slightly wet tongue with a weak pulse. For liver blood deficiency, there will be pale hands, dizziness, blurred vision, floaters, numbness or tingling of limbs, scanty menstruation, dull pale complexion, a pale tongue, and a choppy or fine pulse. For heart blood deficiency, there will be pale hands, palpitations, dizziness, insomnia, dream-disturbed sleep, poor memory, anxiety, propensity to be startled, dull pale complexion, pale lips with pale and thin tongue, and a choppy or fine pulse. Red dorsum of the hands is generally due to full heat, particularly of the heart, lungs, or stomach. For red dorsum of the hands that indicates full heat, there will be hot hands, feeling of heat, thirst, and red face. Other symptoms and signs depend on the organ involved, which may be the heart, lungs, or stomach. Red palms are generally due to empty heat, particularly of the heart, lungs, or stomach. For red palms of the hands that indicate empty heat, there will be hot hands, hands that become hotter in the afternoon and evening, feeling of heat in the afternoon or evening, thirst with desire to drink in small sips, and other symptoms and signs will depend on the organ involved, which also may be the heart, lungs, or the stomach. Thank you so much for your attention.